Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Podful of Pediatrics. Subscribe here for more content.
Or you can visit us at the website at onecommunityhealth.org.
Or follow us on social media at One Community Gorge.
And this is the one where we talk about rotavirus.
So rotavirus is a disease that causes terrible vomiting diarrhea that is absolutely the worst for babies.
Yeah, it is really disgusting. I'm sorry.
Yeah, no, it really is. And prior to the vaccine, it was really common cause of hospitalizations for infants. Like that used to be when we were in residency, one of the leading causes of admissions. And it was such a gross diarrhea. You literally would know when they get to the floor. You'd be like, oh, there's a baby here with rotavirus.
It does have a very distinctive smell to it. And it is really common in the winter. So our winters when we were in residency and at the hospital were really spent with like RSV, which is a respiratory illness, and rota, just so much vomiting, diarrhea.
Not like rest and relaxation. No, rotavirus and RSV.
And RSV. And that was what was most of our hospitalizations, really until the vaccine was invented. But the hard thing about it is that rotavirus is particularly difficult for babies under a year, and specifically newborns and infants who are young. And it's just because they're nauseous, they're vomiting, they're having an amazing amount of diarrhea.
Yes.
And really, my son had this because he was between the vaccines. Like they had an original vaccine that was, which we'll talk about, was made and then taken off the market. And then before they made the second vaccine, I had my son. And so we still had a lot of rotavirus at that time. And I remember taking care of him, and like he'd already vomited and had a bunch of diarrhea. So I took him and carried him into the shower, and he had another episode. And it was like explosive diarrhea we have a glass shower, the entire glass. Like I'd never seen that much poop coming out of a person, right?
How can something so little make so much poop?
I was terrified. Like it actually is really scary. And he was like 15 months old, so he was a little bit older.
Oh, that's really rough.
But it was so much poop, and really trying to manage to keep fluids in to replace all of that they're losing is why kids get so sick from it.
Yes.
It's so hard to replace all of that, and especially for newborns and infants who basically when they're nauseous they just won't drink, right? And that's where it can be really dangerous, and often where you had the ER evaluations and then admissions.
Right. And it's such a contagious disease.
Super contagious.
Yes, like you only need a tiny amount of it to get really sick, and the babies transmit it from 10 to 21 days, right? So even when they start to feel better and they go back to daycare or they go with their older siblings, they still can be spreading it.
They're still spreading it and shedding it. And it is a fecal-oral route, which I know nobody likes to think about.
Yes. But that's how kids spread a lot of things, is, hands in the mouth.
Yeah, they touch something and then put it in their mouth, right? And so it is really easy to get and very easy to spread.
Exposure time of less than 20 minutes. Like
less
you could
than
be
20
in the
minutes.
grocery store and they just have their hand on one thing and there you got rotavirus.
Now your baby's gonna have rotavirus, and it's fast. Like it's a period of incubation period's less than 48 hours. So it is a really fast with a very mild dose, and it's not all vomiting and diarrhea, right? There are also some other complications from rotavirus.
It used to be one of the leading causes of seizures for kids too, for infants too.
Yeah, and some of that is that it has fever associated with it, even some respiratory symptoms. You can get a little runny nose, congestion, cough. Often I felt like that happened after or a little bit later on the side of rotavirus. After you got finally the diarrhea got better,
right?
Now we're gonna have some fun upper respiratory infection symptoms as well. But all of that can be problematic, and so we. Recognizing that this caused so much problems with really hospitalizations and ER visits here, and again, not as much
globally
death, not as much death in the U.S. There still was children who died every year from rotavirus, but it was not as much of that in the U.S. And that was really because we do have great IV fluids, we have great oral replacement,
and we have pretty good medical access.
If you look at other countries, it's actually a major cause of death worldwide.
It's rotavirus. So in 1998, they developed a vaccine called RotaShield, and it was recommended to be given to all babies. But it was withdrawn from the market in 1999 because the government authorities who monitor vaccines, and we'll talk about that a little bit later,
like your FDA,
the
your Federal
FDA,
Drug
the
Administration,
CDC, they noticed there was an increased risk of reporting of intussusception within 2 weeks after getting the rotavirus vaccine.
And intussusception is kind of this weird, it's a long word, but basically it means that, and it can be for lots of different reasons. Intussusception happens like throughout the population of children. It's not super common, but it can happen for different reasons. Basically what happens is the bowel telescopes into itself.
So it just kind of gets stuck and squeezes and can't get apart, and it can actually kill the bowel and
causes vomiting, abdominal pain, pretty severe abdominal pain. And so what they noticed is that while intussusception occurs regularly, like at a rate of about 1 child in every 2,000 children, that when you looked at the RotaShield vaccine, it estimated that about 2 additional cases of, so basically going from 1 child to 3, basically 2 to 3 children, and in every 10,000 infants.
Right. So it was this very slight increase, but it was an increase, and so they removed the vaccine, and they said, let's try again. So that was withdrawn in 1999. In 2006, which one came first? Rototech came first, and then 2008, Rotarix came. And these are both vaccines that are oral, which means you take them by mouth.
And they actually seem like they taste really good. We can't taste it.
No, we don't want to taste it.
You're not supposed to taste those things.
I'm always a little curious because some babies act like it's so yummy, like it's so good when they get it, and some babies are like, what are you trying to give me? I don't like it.
But it actually does seem to work, or it is one of those things that babies usually tolerate very well.
Yes. So the vaccine is given from as earliest as 6 weeks and up to 8 months of life, and it is given either 2 times or 3 times, depending which brand that your provider carries.
Right. And the big thing about this vaccine is that it is actually very well tolerated. There might be a little mild fever, although that's pretty rare. Vomiting and diarrhea being the most common side effect from it.
It's only about 20%.
And it's not near the diarrhea that you would see from rotavirus. It is not similar in any way.
No.
There have been a couple cases, or not, I shouldn't say a couple. They have noticed some intussusception still with this and Kawasaki's, but very mild and not more than the rate that we would expect in the general population, which is why we do not consider those problems for these vaccines.
No, it's not happening more with this vaccine than it would be happening without the vaccine.
Right, and so it is definitely, these vaccines are better than the original RotaShield vaccine.
And so really the only contraindication to getting the vaccine is if the baby does have a history of intussusception. Would be super rare in the age group we give it, but if they had it, then you're like, don't risk it.
Or if there's immunodeficiencies. Again, this is actually one of those, it's an attenuated virus, but it is a live virus. So, so they don't recommend giving it in infants who have other immune deficiencies. And sometimes they will watch, like if someone in the family has cancer and is immunodeficient for those reasons, they might discuss about how to give the rotavirus vaccine there.
So since the rotavirus vaccine came about in 2006, the number of hospitalizations and emergency department visits and even just outpatient visits to doctor has gone down 84 to 90% in the U.S.
Yeah,
like
huge.
It's just, we just don't see it anymore.
Yeah, so this makes, when I was working in the hospital, this is such a difference, right? Since we've had this since 2006, our winters are not all about rota anymore.
No,
it's one of the R's is off.
And hopefully the other R is going to be gone too.
That's right, That's right. We'll talk about that one later. But definitely one of the R's is so much better. And it is really a safe and effective vaccine. I know, again, there's been some misinformation out there that that rotavirus vaccine can cause more deaths than the rotavirus itself, the rotavirus illness itself, and that just is not true. This vaccine is very safe, very effective. Again, the most common complication is diarrhea, but way less than you would see from the rotavirus itself. And I can promise you that is true.
We don't want to see that. So when we talked about RotaShield being taken off the market, that came about because the VAERS system, which means it's an acronym because the government loves acronyms, Vaccine Adverse Event Reporting System. And that VAERS system is a publicly available, searchable database of reports that have not been verified. It basically, anyone can report to VAERS as long as they're reporting about something that happened that they think is related to a vaccine.
Right, right. And again, this is actually really important when we talk about vaccines in our studies, because again, one of those things that people talk about as being a problem with vaccines is that, one, they weren't well studied, and that also isn't true.
No,
they go through a really rigorous study.
On average about 10 years.
Yeah, for vaccines. But then two, that we don't pay attention to it after they're out. And that also is not true. VAERS is one of the reporting systems, but there's actually multiple. VAERS is interesting because it is like a voluntary reporting, and anybody can do it. So it can be the patient themselves, it can be staff, it can be things, and it's anything that's reported.
Right. So if someone gets into a car accident on the way home from the doctor's office, they can report that, even though we say probably not related to the actual vaccine you got.
Right. Or if you break a leg because you're playing soccer in a game after you got that vaccine, you can report that. Now, the reason that it's cool is that if you have, people study these, FDA, CDC, they study these things and they look for patterns. So those patterns are what helped us recognize that there was this intussusception risk that was happening more frequently with the rotavirus vaccine. For some of the other vaccines, I like to talk about one we give in adolescents. They noticed that kids actually passed out. They got dizzy and passed out after the vaccine. Again, it was right after the vaccine. So the vaccine wasn't like causing any major issue.
It just hurts a little bit more than some other ones.
But they actually like redefine some of the things, like make the child eat something and drink something
and
before.
Stay for a little bit. Don't just walk out.
Like don't just jump up and walk out after you get a vaccine. Like hang out for a few minutes. Kind of take a break.
Teenagers never want to do in your office.
They never want to do. And most of them have come in without eating or drinking anything. Yes. I swear, I get so much of that. So now I have Gatorade and I have some like crackers and I make them eat and drink something before they get the vaccine. And I find that actually works really well.
Yes. And some of the other VAERS successes are polio. We talked about that in another podcast.
Right.
The change that happened was because of some things that were reported through the VAERS system. And myocarditis that had happened after a few, mostly adolescent males, had the COVID-19 vaccine. That was brought about with VAERS and investigated and found actually it was less likely to happen than with the actual disease itself. The vaccine made the myocarditis less likely and non-fatal, as opposed to COVID-19, which actually caused some fatal myocarditis.
Right. And so again, these systems are designed to pick up things that they weren't noticing, because even though they did these expansive studies,
just all of a sudden more people were getting the vaccine.
More people got the vaccine, and now we find some things that we weren't seeing before. And so that's the whole design of our system, is that we keep studying, we keep trying to make things better. And this, like especially the rotavirus vaccine, is one of those times where these vaccines that we use now is so much better than the first vaccine we had, and is not only saving lives internationally, definitely, some even in the US, because again, we did have deaths from rotavirus every year. But if you look at that, now it's available in more than 100 countries.
Right, because there's other vaccines other than the ones we talked about that are available in other countries.
Right, and that's led to 40% decrease in hospital admissions for rotavirus in children younger than 45 years, all over the world. And then global rotavirus-related deaths have decreased by 25%. And again, there's no, and even the deaths now are still because their access to services is really poor in a lot of the other developing countries. We're lucky to live in the country we do with respect to with being able to get that type of health care. And that has definitely decreased mortality from rotavirus. But this vaccine has absolutely decreased our ER visits and hospitalizations.
And with the VAERS, just wanted to point out again, it's searchable, publicly available, so people sometimes will read things on there and assume causal relationships when it's actually just a reportable incident that needs to be investigated more. It's kind of just raising the hand of, could it be related or not?
And again, searching patterns. That's what it really helps us do, is find those patterns that then we can research and see if it's really a problem. It is not just because one thing happened and it's reported in there does not mean it's causal to the vaccine itself.
Yes.
And that is really important. There are other additional systems that, like we have a CDC vaccine safety data link,
which OCHIN, which is where we're kind of
one community health
with, and then also Indiana University, where we used to be affiliated with. They're both in the vaccine safety data link. It's 11 healthcare organizations across the country, and there's also the clinical immunization safety assessment, which is 8 other centers. So there's lots of places looking at vaccines to make sure they're safe that are separate than the VAERS system.
But the VAERS system is one of the ones people talk about because they like to, because it's publicly available to everyone.
You can look on there and see.
But remember, take a grain of salt when you're looking at it. That's just one person's report, and you have to look at it for patterns and data. But it is an important part of safety,
It is,
and it
and I'm
can
glad
absolutely
we have
change
it,
things.
for
I am
sure.
so glad we have it. So again, rotavirus is safe, effective vaccine that has been very well studied, and it is designed and will help your baby stay healthy through any and prevent rotavirus infections.
And also help prevent us having to smell
The
that disgusting
horrible,
diarrhea.
or get your whole shower with like a painting job of poop.
Yes, you can just avoid that with a vaccine.
You can just avoid it. Rotavirus vaccine, safe, effective, and is a good way to keep your child healthy, happy, and safe.
I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Pod Full of Pediatrics.